Your feet contain 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments. They are the furthest point from your heart, and they are the first place in your body where serious disease becomes visible. Yet most people never look at their feet. Not carefully, not the way a doctor does. You glance at them in the shower, you notice them when something hurts, but you are not reading them, and your feet are writing you a report every single day. A report about your circulation, your nervous system, your kidneys, your liver, your heart, and your metabolic health. 7 signs, all below the ankle, all ignored by the majority of people who have them, all connected to conditions that are far easier to treat when caught early than when caught late. Please subscribe to Dr. Nathan Hayes and hit the like button. This channel exists because the system profits when you stay sick, not when you get better. What I am about to tell you, nobody at your next appointment is going to check unless you ask. Before we start, a necessary statement as a physician with 15 years of clinical experience. If you currently have an open wound on your foot that is not healing, if the skin around a wound is turning black, or if you notice a sudden loss of feeling in both feet accompanied by severe pain in the legs, do not wait. See a doctor today. These can be signs of critical limb ischemia or diabetic emergency that require immediate intervention. If none of those apply to you, stay with me. We have time to learn what your feet are saying. Sign number 1, the one hiding in plain sight. Persistently cold feet, not cold because you forgot your socks. Cold when the room is warm, cold when the rest of your body feels fine, one foot colder than the other, feet that never seem to warm up regardless of blankets, socks, or hot water bottles. Most people dismiss this as poor circulation in the general sense, as if it is a minor inconvenience of aging. It is not minor, and it is not vague. Persistently cold feet are a specific clinical finding with a specific cause. The most common cause is peripheral artery disease, PAD. This is the buildup of fatty deposits inside the arteries that supply blood to your legs and feet. The arteries narrow, blood flow decreases. The extremities, your feet, receive less warm, oxygenated blood. Here is the number that should concern you. More than 8 million Americans over 50 have PAD. Roughly half of them are undiagnosed because the early symptom, cold feet, was dismissed as normal. PAD is not just a foot problem. It is a cardiovascular disease. The same plaque narrowing the arteries in your legs is narrowing the arteries in your heart and brain. A person diagnosed with PAD has a 4 to 5 times higher risk of heart attack and stroke. Your cold feet are not an inconvenience. They are an early warning system for your entire cardiovascular system. The test is simple. It is called an ankle brachial index, ABI. Your doctor measures the blood pressure in your ankle and compares it to the blood pressure in your arm. The ratio tells you exactly whether blood flow to your feet is compromised. It takes 5 minutes. It is non-invasive. Ask for it by name at your next appointment. Sign number 2, the one people blame on shoes. Numbness, tingling, or a burning sensation in your feet. Pins and needles, a feeling of walking on cotton, a sensation that your socks are bunched up when they are not, or a slow, progressive loss of feeling that started at your toes and has been creeping upward over months or years. This is not a shoe problem. This is not a posture problem. This is peripheral neuropathy, damage to the nerves that supply sensation to your feet. And the most common cause in adults over 50 is one word: diabetes, specifically chronically elevated blood sugar. When blood sugar stays above normal ranges for extended periods, the glucose molecules physically damage the small blood vessels that feed your peripheral nerves. The nerves starve. They begin dying from the tips inward, toes first, then the ball of the foot, then the sole, then the ankle. This is called a stocking distribution pattern because the numbness follows the shape of a sock pulling upward. And here's what makes this genuinely dangerous. When you lose feeling in your feet, you stop noticing injuries, you step on something sharp, you do not feel it, the wound goes unnoticed, it becomes infected, the infection spreads. In severe cases, this is how amputations begin, not from a catastrophic injury, from a small wound that was never felt because the nerves were already dead. The critical action here is a fasting blood sugar test and an HbA1c test. HbA1c measures your average blood sugar over the past 3 months. If your HbA1c is above 5.7%, you are in pre-diabetic range, above 6.5% diabetic range, and your neuropathy has a confirmed cause. Sign number 3, the one your kidneys are sending through your ankles. Swelling in both feet and ankles that worsens throughout the day. You press your thumb into the skin above your ankle bone, and the indentation stays for several seconds after you remove your finger. This is called pitting edema. Mild swelling after a long day of standing can be normal. What is not normal is pitting edema that is present every day, that worsens progressively over weeks, and that does not resolve completely overnight. Pitting edema in both feet has 3 primary medical causes. First, heart failure. When the heart cannot pump blood efficiently, fluid backs up in the veins and leaks into the tissues. Gravity pulls it to the lowest point, your feet and ankles. Second, kidney disease. Your kidneys filter approximately 200 liters of blood per day. When kidney function declines, they cannot remove excess fluid and sodium efficiently. The fluid accumulates in your tissues, starting at the extremities. Third, liver disease. The liver produces albumin, a protein that holds fluid inside your blood vessels. When liver function declines, albumin production drops. Without enough albumin, fluid leaks out of the vessels and pools in the tissues. 3 organs, heart, kidneys, liver, all of them can announce their failure through your feet before any other symptom appears. A basic metabolic panel, a kidney function test, and a simple albumin level will tell you which organ is struggling. Do not wait for the swelling to become severe. By then, the organ damage is advanced. Sign number 4, the one that looks cosmetic but is not. Your toenails have become thick, yellow, crumbly, and misshapen. They separate from the nail bed. They are difficult to cut, they look diseased, and your doctor told you it was just a fungal infection. Sometimes it is fungal, but not always. And here is what most doctors do not take the time to investigate. Thick yellow toenails can also indicate peripheral artery disease because reduced blood flow deprives the nail matrix of oxygen and nutrients. They can indicate psoriasis, an autoimmune condition that affects far more than just the skin. They can indicate thyroid disease because both hypothyroidism and hyperthyroidism alter nail growth patterns. And they can indicate diabetes because high blood sugar creates an environment where fungal organisms thrive and the immune system cannot adequately suppress them. The point is this: do not accept a casual diagnosis of toenail fungus without asking what is causing the fungal environment. A healthy body fights off fungal infections efficiently. A body with compromised circulation, immune suppression, or metabolic dysfunction cannot. The nail is the symptom. The question is what created the conditions. Sign number 5, the one that shows up at night, painful cramping in your feet or calves that wakes you up at night. Your toes curl involuntarily. The arch of your foot locks into a spasm. The pain is sharp, sudden, and takes minutes to release. Most people assume cramps are from dehydration or potassium deficiency. Sometimes they are, but when foot cramps are persistent, occurring multiple times per week, and specifically at night, there are deeper causes to investigate. First, magnesium deficiency. Magnesium is required for proper muscle relaxation. When magnesium is low, muscles contract but cannot fully release. The result is a cramp. Published research estimates that over 50% of adults over 50 are magnesium deficient without knowing it. Second, peripheral artery disease again. Reduced blood flow to the feet and calves means less oxygen delivery to the muscles during rest. At night, when blood pressure naturally drops and circulation slows, the oxygen deficit becomes severe enough to trigger cramping. Third, nerve compression. Conditions like lumbar spinal stenosis, narrowing of the spinal canal in the lower back, can compress the nerves that supply the feet and calves, causing nocturnal cramping that has nothing to do with mineral levels. If your cramps are frequent, start with 2 interventions. First, increase magnesium through food. Pumpkin seeds, almonds, dark chocolate above 70% cacao, spinach, and black beans are the richest food sources. A handful of pumpkin seeds per day provides roughly 40% of the daily magnesium requirement. Second, request an ABI test to rule out peripheral artery disease and mention the cramps to your doctor so they can evaluate for spinal stenosis. Do not simply take potassium supplements and hope the cramps stop. Find the cause. Sign number 6. The one that reveals your liver without a blood test. Small red or purple spots on the soles of your feet, not bruises, not from standing, tiny pinpoint hemorrhages that appear spontaneously, sometimes in clusters, sometimes scattered. These are called petechiae. They are caused by tiny blood vessels, capillaries, leaking blood into the surrounding tissue. In isolation, a single petechial spot can mean nothing. In clusters, appearing repeatedly, they are a clinical finding that warrants investigation. Petechiae on the feet can indicate a low platelet count, thrombocytopenia, which means your blood cannot clot efficiently. This can be caused by liver disease, because the liver produces thrombopoietin, the hormone that stimulates platelet production. It can be caused by certain medications that suppress platelet function. It can be caused by autoimmune conditions that destroy platelets. And in rare but serious cases, it can indicate endocarditis, an infection of the heart valves that sends tiny clots to the extremities. If you notice pinpoint red or purple spots on your soles that you cannot explain, you need a complete blood count with platelet count. Do not assume they are from pressure or friction. Petechiae do not blanch when you press them. If you press a glass against the spot and it does not disappear, it is blood beneath the skin, not surface redness. That distinction matters. Sign number 7, the one that frightens me as a clinician because of how often it is ignored. A wound on your foot that will not heal, a blister that has been open for weeks, a small cut that should have closed in days but is still there after a month. The edges are not closing. The tissue around it looks unhealthy. Perhaps there is drainage, odor, or discoloration. A wound that does not heal on the foot is a medical emergency in slow motion. The foot is the most vulnerable area for non-healing wounds because it is the furthest from the heart, receives the least blood flow, and bears the most mechanical stress. When a wound will not heal, it means one or more of 3 things. First, insufficient blood supply. The wound cannot heal because the tissue is not receiving enough oxygen and nutrients to build new cells. This is peripheral artery disease. Second, nerve damage. You cannot feel the wound, so you continue walking on it, reopening it with every step. This is diabetic neuropathy. Third, immune suppression. Your body cannot fight the bacterial colonization in the wound bed. This can be diabetes, malnutrition, or medication related. If you have a wound on your foot that has not improved in 2 weeks, see a doctor. Not in a month, not when it gets worse. Now, non-healing foot wounds are the #1 cause of lower limb amputations in the developed world, and the majority of those amputations were preventable if the wound had been evaluated early. 7 signs, let me lock them in. Persistently cold feet, numbness, tingling, or burning, pitting edema in both ankles, thick yellow crumbly toenails, nocturnal foot cramps, red or purple pinpoint spots on the soles, non-healing wounds. If 3 or more of these apply to you, your feet are not aging. They are signaling, and you need to respond. How old are you? Write your age in the comments. The reason I ask is that every one of these 7 signs becomes more prevalent and more dangerous after 50. Your age shapes which risks are most urgent for you. That number helps me build content that targets exactly where you are. Now, what do? You need to start checking your feet the way a clinician does. Here is the self-exam protocol that I teach every patient over 50. Step 1. Sit in a well-lit room. Remove your shoes and socks. Look at the tops of both feet, the soles between every toe, and the nails. You are looking for color changes, swelling, spots, wounds, nail changes, and skin cracks. Do this once per week. If you cannot see the soles of your feet easily, place a mirror on the floor and hold each foot over it. Every podiatrist in the world will tell you that the patients who check their feet weekly catch problems months or years earlier than those who do not. Step 2. Press the back of your hand against the top of each foot. Compare them to each other. One foot noticeably colder than the other is a circulation finding. Both feet persistently cold compared to your lower legs is a systemic circulation finding. Step 3. Take a pencil eraser. Close your eyes. Have someone press the eraser lightly against different areas of your sole, ball of foot, arch, heel, and each toe. Can you feel every touch? Can you distinguish between light and firm pressure? Any area where you cannot feel the touch is a nerve finding that warrants medical evaluation. Step 4. Press your thumb firmly into the skin above your ankle bone for 5 seconds. Remove your thumb. If the indentation stays for more than 3 seconds, you have pitting edema. Note which foot and how long the indent persists. Step 5. Look at each toenail individually. Are any thickened, yellowed, crumbly, or separating from the nail bed? Have any changed shape or color in the past 6 months? Nail changes that developed gradually are more significant than acute injuries. 5 steps, 2 minutes, once a week. This is the single most effective screening routine you can perform at home for cardiovascular, metabolic, and neurological disease. It costs nothing, it requires no equipment, and it catches problems that blood work sometimes misses because the feet show changes before lab values cross diagnostic thresholds. Now, supporting your feet and the systems they reflect. First, circulation. Walk for 20 minutes every day. Walking is the single most effective intervention for peripheral blood flow. When your calf muscles contract during walking, they squeeze the veins and arteries in your lower legs and physically push blood back toward your heart and down toward your feet. This is called the calf muscle pump. If walking is painful due to cramping, walk until the cramp begins, stop and rest until it passes, then resume. This is called supervised claudication exercise, and it is the first-line treatment for peripheral artery disease. The discomfort is the treatment. Your body responds to the intermittent oxygen deficit by growing new small blood vessels around the blockages. Over weeks, circulation measurably improves. Second, nerve protection. If you have any neuropathy symptoms, your first priority is blood sugar control. Eliminate processed sugar, refined carbohydrates, and sweetened drinks. Every glucose spike causes additional nerve damage. Replace with whole foods, complex carbohydrates, and adequate protein. Add alpha-lipoic acid through food sources. Spinach, broccoli, and organ meats contain meaningful amounts. Alpha-lipoic acid is an antioxidant that has demonstrated neuroprotective effects in clinical studies on diabetic neuropathy. It scavenges the free radicals that damage nerve tissue under high glucose conditions. Third, kidney and fluid support. Drink a minimum of 50 ounces of water daily. Reduce sodium intake aggressively. Most processed food contains far more sodium than you realize. A single fast food meal can contain 2,000 milligrams, which is the entire daily recommended limit. Excess sodium forces your kidneys to retain water. That retained water pools in your feet and ankles. Cutting processed food and adding a glass of warm water with lemon each morning supports both kidney function and liver bile flow, addressing 2 of the 3 organ systems that cause edema. Fourth, evening leg elevation. Every night, lie on your back and elevate your legs against a wall for 10 minutes. This uses gravity to drain accumulated fluid from your feet and ankles back into your central circulation. The fluid returns to the kidneys and is excreted. Over time, consistent elevation measurably reduces chronic edema. I had a patient, I will call him Frank, 67 years old, retired postal worker. He came to me because his wife noticed his feet were always cold and he had been getting cramps at night for 6 months. He assumed it was aging. His primary care doctor had told him to eat more bananas. I checked his feet. Both were cool to the touch. His ABI was 0.72 on the right and 0.78 on the left. Normal is above 1.0. He had moderate peripheral artery disease that had never been diagnosed. His fasting blood sugar was 119 pre-diabetic range. He had early neuropathy in his toes that he had not noticed because the loss of sensation had been gradual. I put him on a supervised walking program, 20 minutes daily with rest intervals. We eliminated processed carbohydrates and reduced sodium to under 1,500 milligrams per day. He added pumpkin seeds daily for magnesium, evening leg elevation for 10 minutes every night. After 8 weeks, his night cramps had stopped completely. His feet were warmer. His repeat ABI showed improvement to 0.81 and 0.86. His fasting blood sugar had dropped to 104, still pre-diabetic, but moving in the right direction. Frank did not need surgery. He did not need a stent. He needed someone to look at his feet and connect the signals to the systems they were reporting on. Here is your 5-step plan for this week. Step 1. Tonight, do the full 5-step foot self-exam I described: visual inspection, temperature check, sensation test, edema press, and nail inspection. Write down what you find. Step 2. Tomorrow, call your doctor and ask for an ankle brachial index, a fasting blood sugar, an HbA1c, and a basic metabolic panel with kidney function. If they ask why, tell them you have noticed changes in your feet. That is enough. Step 3. Start walking 20 minutes daily. If cramps stop you, walk, rest, walk. The discomfort is the treatment. Step 4. Tonight, reduce your sodium. Remove one processed food from your kitchen and replace it with a whole food alternative. Step 5. Before bed tonight, elevate your legs against a wall for 10 minutes, every night this week. 5 steps, 0 cost. The self-exam takes 2 minutes, the walking takes 20, the leg elevation takes 10. The total daily investment is 32 minutes that could prevent years of medical intervention. Nobody at your next clinic visit is going to take off your shoes and examine your feet unless you are already diabetic and already in trouble. There is no billing code for a preventive foot check in a general practice appointment. There is no time for it. There is no financial incentive for the system to catch the problem before it becomes a procedure. I am Nathan Hayes, and I have spent 15 years watching what happens when people ignore the signals below their ankles. Cold feet become amputations, numb toes become non-healing wounds, swollen ankles become heart failure diagnoses, and every single one of those outcomes had an early warning sign that was visible, testable, and treatable if someone had looked in time. Your feet are writing you a report. Read it, subscribe if that difference matters to you. Please subscribe to Dr. Nathan Hayes and hit the like button. See you in the next video, and thanks for watching.